Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Can I come in?
Of course, please take a seat. What brings you here today?
I was diagnosed with breast cancer 4 years ago and underwent a mastectomy followed by chemotherapy. Last year, I was diagnosed with another cancer, this time in my ovaries, and underwent surgery for it as well. Recently, I've noticed I have difficulty breathing and a persistent cough.
I'm sorry to hear that. How long have you been experiencing these symptoms?
It started about 3 weeks ago, and it's been getting progressively worse.
Do you have any other health conditions or previous surgeries aside from what you mentioned?
Just the 2 cancer diagnoses. I also had an appendectomy when I was a teenager.
Are you currently on any medication?
I'm taking tamoxifen for the breast cancer and some painkillers as needed.
Any known allergies to medications?
I'm allergic to penicillin.
Can you tell me about any family history of illness?
My father passed away at 68 from lung cancer, and my mother has high blood pressure. My elder sister was diagnosed with uterine fibroids, and my younger brother has asthma.
All right, let's take a look at your lab results. Your white blood count is slightly elevated at 15.2, hemoglobin is at 13.1, hematocrit at 40.7, and platelets at 220,000. Your chest x-ray shows some haziness in the lower left lung field. Given your medical history, especially with the 2 cancer diagnoses, we need to be thorough in our investigations.
What do you suggest, doctor?
I recommend we do a CT scan of your chest to get a clearer picture of what's happening in your lungs. It's important to rule out any metastasis or other complications. Additionally, given the persistent cough and difficulty in breathing, I'll prescribe you an inhaler to alleviate those symptoms temporarily. Once we have the CT results, we'll discuss the next steps.
Thank you, doctor. I appreciate your thoroughness.
You're welcome. It's essential to be proactive with your health, especially given your history. We'll get through this together. Please schedule the CT scan as soon as possible, and I'll see you after that.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good afternoon.
Good afternoon. How can I help you today?
Doctor, I've been experiencing severe stomach pain and bloating for the past month.
Where exactly is the pain located? Is it constant or does it come and go?
It's around my navel and sometimes a little to the right. It comes in waves, but has been persistent for the past few days.
Have you noticed any changes in your bowel habits or any other related symptoms?
Yes, I've had constipation followed by episodes of diarrhea. I've also felt nauseous on occasion.
How about your appetite?
It has decreased significantly, doctor. I barely feel like eating.
Do you have any other medical conditions or have you had any surgeries in the past?
I was diagnosed with type 2 diabetes last year, and I had an appendectomy when I was a teenager.
Are you on any medications for your diabetes?
I take metformin 500 milligrams twice daily.
Do you consume alcohol or have a history of smoking?
I drink occasionally, maybe once a month, and I quit smoking 5 years ago.
Any family history of gastrointestinal diseases or issues?
My mother had irritable bowel syndrome, and my grandfather had colon cancer.
Okay, let's have a look. Upon palpation, your abdomen seems tender, especially around the right lower quadrant. Given your symptoms in physical examination, I suspect it might be Crohn's disease or perhaps a form of IBD.
Oh, that sounds serious. What's the next step?
I'm going to order a colonoscopy for a closer look. In the meantime, I'll prescribe you some pain relief and an antispasmodic for the abdominal pain. It's crucial that you follow up after the colonoscopy so we can discuss the results and determine the best treatment plan.
Thank you, doctor. I appreciate your help.
You're welcome. Take care, and please don't hesitate to contact the clinic if your symptoms worsen.